pretty scary.
Yeah, how long ago was that?
4 years ago maybe. He was in the ER 4 times, like over a 4-day period daily to get injections of antibiotics, and finally it turned the corner.
Wow.
Yeah.
Do you want me to lay you back while I do this?
Oh, so I don't have to watch?
Well, only if you want to.
How about if I let you know?
Okay, that's fine.
I like watching.
Okay.
I usually don't have a problem. Although when I had a, what is that called? That disease that they test for under the skin.
Oh, tuberculosis.
Yeah, I had a TB test. Almost passed out.
Ah.
Because they were shooting something under my skin. It freaked me out.
Well, that's what I'm going to do right here. You're going to feel a little bee sting.
Oh yeah, I am.
Okay. You can see it coming out
I
already there.
can. So that's the.
That's just the anesthetic.
Novocaine or whatever.
Yep, it's lidocaine.
Lidocaine.
And then I'm just going to test. Do you feel anything sharp right here?
Yeah.
Okay, how about right here?
Yeah.
Okay, we'll just give it another second or two. Usually it's pretty
I'm a
immediate.
slow learner.
Usually it's pretty immediate, but so some of this is coming out already. You can see, you can just, and it's kind of thick and gooey, and that's joint fluid, essentially. Anything sharp here?
Nope. Oh yeah, that is super thick.
Yeah. Medical world, we say viscous.
Viscous.
Sounds more medical.
We say that in the geologic world as well.
What, you said you travel a lot for work. What kind of work do you do?
I work in international education. I open and support like K-12 programs in about 8 different countries. Well, if nothing else, for a little while it'll be smaller.
Yeah, now there's like a separate compartment over here.
Okay.
So what I'd like to do, even though I know your husband had a bad experience with 2 different sticks, if it's okay with you, I'm gonna numb that up here and just, I can get a new needle.
Is there any way to clean that needle?
No, I mean, I can get a new needle. That's not a problem.
It was a terrible situation.
Yeah, no, I understand. Let me go get a little bit more lidocaine to numb up that side.
Okay.
And sometime. So what is international education? Like what?
We partner with people who want to have like an American program at their school, or want to actually open an American school
Oh, okay.
in their city.
This is a little more numbing medicine.
So help with, initial setup, curriculum, accreditation.
Brand new needle.
Thank you.
No, I understand your concern. So you create like American schools. Is this sharp here?
No, that was quick.
Yeah, that's usually how
Oh, that
it
is,
is.
but it'll numb up.
It's getting a little more.
Good. So,
So where have you been most recently?
Taiwan.
Sorry. Just gonna change directions here. looks like we're not getting any more out. Okay. Sometimes if we then put some pressure on it, so that was 2 cc's of fluid. But sometimes then if we put some pressure on it, we can get some of it out. Sometimes it's kind of more solid in there,
Okay.
and so it doesn't come out even though it feels quite squishy. Yeah, we're not getting any more out here. So what we'll do then is, I'm just gonna put a little bit of cortisone in there.
Okay, I forgot about that step.
Yeah.
And what is that supposed to do?
The goal is that it will help dry up the cyst area so that it doesn't come back.
Okay.
And, is it, new needle, is it 100%? No. We may still end up going to surgery for it, but it's worth trying
Yeah.
before we talk surgery, so. Okay, and then I'm gonna put what's called a pressure dressing on this, which is just like a little elastic. That'll keep some pressure on it. Okay, a little sticky spray here.
First time with a sticky spray for me. I've not had that before. That keeps the dressing
This is
more
It's just
attached?
well, that's just a Band-Aid, that's not the dressing. This is just an elastic tape that will put a little, oh, you mean the...
Yeah, what's with the sticky spray?
Oh, the sticky spray helps us hold longer. So keep this on for a day. If it comes off, it comes off. But try and keep it on like till tomorrow morning.
Okay.
And then
If it's still well attached tomorrow morning, keep it on during the day or take it off?
you can leave it on for a couple of days, but usually once it gets wet, it'll come
Yeah.
off. Okay. So that's putting a little pressure over it.
Yep.
And so what I would recommend is let's get you back in, or set up a follow-up in about 3 or 4 weeks.
Okay.
And that way, if it looks like we're gonna need to talk about going in surgically, fine. If it's doing great, you can
Mhm.
always cancel and just leave me a message
Okay.
so that I know that's why you canceled.
So basically, if it's still there,
Yeah,
I should come in.
I would set up the appointment so you have it. Because
Yep.
if this is gonna work, you'll know within a few weeks.
Okay, because that will continue to go down.
This is just so
Oh.
you don't stick to everything. And then if, if it's no different after
Mhm.
3 or 4 weeks, then I think what we'll do is discuss going in surgically.
Okay.